Good morning, dear students. My name is Aili Wanga, a registered nurse pursuing my postgraduate diploma in nursing education. I'm going to give you a lesson today in General Nursing Science 3. And I know we are all the third year students here that are sitting. We are not mixed up because of the beginning of the year, We might be getting lost. Okay, at the beginning, we are going to have a learning objective whereby a student should be able to define the patient safety and its importance in the healthcare setting. We are going to discuss how to ensure patient safety during the hospital stays, clinic, and health center, whereby we have to include physical environment of the patients and emotional and social aspects of the patients. We are going to identify the common safety risk in the wards, in the hospitals, in the clinic, and in healthcare, in health center settings. Anyone who can describe for us patient safety. What is patient safety? What do you understand it? Yes, it's the absence of preventable harm to a patient and the reduction of the risk of unnecessary harm associated with healthcare. This is according to World Health Organization. What are the importance of patient safety? Is to prevent harm and to save the life of the patient. To prevent harm and to save the life of the patients, and to build trust in the healthcare setting. If the patient feels safe, they are more likely to come to return to the health facility. It reduces healthcare cost. It's also a human right. Every person is entitled to safety care. The physical environment whereby we include the floor of the patient of the ward must be clean. The floor must not be slippery. There must be adequate ventilation, adequate light. Why do we have to have adequate light? The person might be falling, the person might be hit themselves against the wall. If the floor is wet, they are falling. Those are the things that we have to prevent in the healthcare setting. And as we are talking about emotional and social aspect of the environment. What do we mean by that? Whereby our attitudes of the patient personnel in the ward, in the clinic, we are not treating the patient with love. We have anger issues. We are not listening to the patients. We must also avoid avoidance of disturbing factor which may upset the patients. And we have to promote a happy environment of nursing and build a good nurse-patient relationship based on the mutual respect and trust. Those are the things that we have to practice when you are going to hospital setup and clinic settings. The common patient safety risk in the ward, we are talking about the medical errors, medical error, pressure source, risk of infection, injury, or falls. Remember, we talk about the slippery, or the wall is slippery, the wall is wet, it's not clean, the bed source or the patients are not cleaned. Those are the things that we are talking about in the wards. And in the clinics and health center setting, the delay of diagnosis, the patient is not diagnosed. Every time a patient is coming back to the clinic, it's not be referred to the next level, never been seen by doctors. Improper and poor hygiene practice. There's no hand wash. There's no them dusting. We are just starting work. Lack of insufficient equipment, whereby we are just starting work. There's no thermometer in the hospital. There's no BP machine. The oxygen cylinder is empty. All those things. Those are the things that we need to take care whenever we are in the health facility. When you are a nurse on duty, you make sure that you have everything. Equipment is there. Okay. We are going to have a group activity that I'm going to leave you with, whereby we are going to divide ourselves in 2 groups, and we are going to have a case scenario of a patient that fall and the one with a mix-up medication. We are going to identify the problem, the cause of the problem, and we have to come up with a solution tomorrow that we are going to discuss it. Any question before we end up the topic? If there's no question, I would like to have you a keynote that what you have to know is the importance of the patient safety, physical environment, and emotional aspect of the patient's environment. Thank you.